I'm from the WHO Regional Office for Europe. I'm based in Copenhagen, Denmark. We are responsible for the medicines dossier, so to say. We've been involved over the last 10 years with national policymakers and agencies and organizations in technology assessment. We organized about 12 years ago a first meeting, and as a result of that, a lot of these networks evolved. We have been doing two reviews of NICE, the National Institute for Health and Clinical Excellence in England, on their technology appraisal program and their clinical guidelines program. And we did a review of, at the request of IQWiC, the Institute for Health, for Efficiency and Quality in Healthcare in Germany, of their patient information program, and looked at HTA and governance issues in the institutions.
HTA bodies are relatively new, especially if you compare it to the telecom sector, which started regulating in the 1980s. Well, can you attach any conclusions yet to what you're seeing happening in the different national member states at this moment when it comes to HTA bodies?
Well, we clearly see that most countries are using one way or another HTA approaches towards making decisions on allocation of resources in healthcare, particularly in the area of medicines, but also increasingly in other technologies. In some countries already very well advanced and well structured, like NICE in England, or the HAS in France, or IQWiC in Germany. But also smaller countries are doing the same: Sweden, the Netherlands, Denmark, etc. And clearly HTA is helpful in informing decision making in national health systems and trying to be as transparent and evidence-based as possible when you make a decision on whether to reimburse a new drug or not.
We're talking here about European level cooperation between HTAs. Do you see a need for a European HTA?
It depends what that would mean. I think at this point in time, no. Let's say health systems are very different, cultures are very different. There is clearly an added benefit when agencies start talking to each other, see how they are set up, what their national mandates are, about methodological approaches on how they do it, because that is different in each of the countries. But clearly, when you look at the pure scientific data that are coming from clinical trials on new medicines, those are basically the same for every country. So there would be an added value for countries talking to each other and see and exchange information on that and exchange judgments on that, on the value of new drugs.
What is your observation about the workshop that just took place?
Very useful. At least this is always, this is a complex area. HTA, as I said, is in sort of an emerging science with lots of methodological question marks and areas for development. There's a great interest from all the stakeholders and from society at large as well. So having an opportunity to discuss that with stakeholders is always welcome and useful. It will not yield any immediate result, but this is a process where we will just need to take some time and develop as we go along.
If you look into the future, 5 years from now, what could we expect to see in the European landscape on an international level?
Always difficult to make predictions, but clearly I will see that it's very likely that there will be an increased interaction between the agencies or the national institutions or ministry around HTA and around evaluation of new technologies for healthcare. And hopefully it will yield also some methodological improvements on what is needed. And importantly, I could imagine and I would hope that also the health technology assessment groups will be working more upstream with industries to make sure that the trials that are being done by the industry are actually asking the questions that are relevant for HTA agencies, because at this point in time it is often the results of the trial are being presented to an agency, and then the agency says, but we would have chosen another outcome indicator, or we would have chosen a different patient group, or whatever, and then you basically have 1 or 2 years of work almost wasted. So a bit of more interaction in the design of trials to answer questions that are relevant would be very beneficial.